Hello students, today's segment we are going to learn about the clinical interview method, which is one of the most influential and clinical endeavors. Clinical interview is supposed to be one of the most important foundations in all clinical endeavors. Clinical interviewing can be defined as the process in terms of communication, where it involves in processing or evaluating the patient's behaviors, which are important in the formation regarding his current behaviors and personality. During the interview, the clinician learns about the various difficulties experienced by the client and also tries to establish rapport towards potential and fruitful relationship. An assessment interview, often considered the central element in the assessment process, usually involves a face-to-face interaction between the patient and the clinician, where the clinician obtains various information about various aspects of the client's life. Not only the client's life, but it also involves the client's life situations, behaviors and various many other personality traits. Clinical interview is not a cross-examination, but it is a means of communication which involves the client's voice intonation, rate of speech, as well as non-verbal communication, expression, gestures and posture. Although it is sometimes used as the sole method of assessment, it is more often used along with several other methods involved in clinical assessments. It serves as a basic contest for almost all other psychological assessments. Now, we are going to discuss about various types of interviews. The first type of interview is the intake or admission interview. Now, this is a purpose in which the initial intake interview or admission interview takes place. It helps to develop a better understanding of the patient's symptoms or concerns in order to recommend the most effective treatment plan or intervention. Whether the interview is conducted for admission to a hospital or as an outpatient clinic or to a private practice or some other settings, the initial interview attempts to evaluate the patients as effectively as possible. Now, who involves in assessments? This is very important. Ordinarily, a psychiatric social worker conducts this interview. However, upon occasions, the psychologist, one of the physicians or a psychiatric nurse may serve as a intake interviewer. Now, what involves in intake interviews? Basic questions to be dealt with. Say for example, why is the patient here? What does she says in the matter with him? Important but secondary questions involve in information about private hospitalization, the name of his doctors, what the patient expects from the treatment, his availability for treatment and the like. The second type of interview is the case history interview. Now, usually when you talk about case history, there are sources of information other than the patient himself, or say for example, information from friends, relatives, hospitals, military and other records are used for the history. But whatever the source of information, the purpose of the social and personal history report is to gather information which will be helpful for effective intervention plan. The typical information obtained in a personal as well as social history includes material on patient's early life experiences with particular attention paid to family relationship and general environment. Sometimes patient's educational background, vocational history and neuropathic traits are also taken. Now, we are going to talk about the third type of interview called mental status examination interview. In mental status examination, there are many things to be considered. Say for example, the appearance of the patient, his speech and various other observable behaviors. Now, when you talk about appearance, how does the patient appear? Is he looking tidy? Is he looking neat and other things? When you talk about speech, whether the patient's speech is coherent or whether he is able to express his feelings in a proper manner. All these factors have to be observed under mental status examination. Apart from these factors, the thought process, whether the individual patient is able to express his thoughts in a proper and systematic manner, is also to be considered. For instance, mental status examination, under which there are certain questions to be noticed. Questions like, what is today's date? Who is the President of India? Where do you come from? So that his memory is being tested. And some other questions like, where are you coming from? And who is the present Prime Minister? And other memory related questions. Not only memory, in terms of decision making is also being observed. How the patient is able to take a particular decision. Why have you come here? Are you willingly have come here or not? Now, the fourth type of interview talks about crisis interview. What is the meaning of crisis? Crisis is any kind of a threatening situation where the patient is involved in a life-threatening incident or event. Very often during the crisis situation, the patient experiences traumatic stress. Especially the role of a psychologist is very crucial, because during the crisis situation, when you talk about crisis, can you think of any particular crisis? Say for example, a person has attempted suicide, or a person involved in any kind of natural disaster. So, it is very crucial for the psychologist to give his counseling at that particular situation. Therefore, he has to consult a hotline where it includes the police personnel, emergency, or a community mental health clinic. Therefore, during the crisis interview, it includes not only the psychologist, but many other personnel such as the police, the emergency hospitals, and many others. In the crisis interview, it becomes very important that there is a situation where they have to break the confidentiality. Say for example, if the individual person is involved in committing suicide or other risk factors, here the role of a psychologist is to break the confidentiality and inform the people who are in the emergency. Now, we are going to talk about the diagnostic interview. Diagnostic interview involves the question and answer sessions. Now, it is as simple as our regular and daily conversations with the people. Similarly, here also the psychologist asks questions and the patient answers. The major focus, especially in diagnostic interview, is the questions are related to the symptoms that are experienced by the patient. Say for example, how long you have been suffering with this particular problem? Did you go for any checkup previously? Are you under medication, and etc. The diagnostic interview method is often substantiated along with the mental status examination. What happens if the patient is a child? So, all the information, necessary information may not be taken from the child. Therefore, the parent or the guardian information is readily available for us. Therefore, counseling or interviewing particular child is very easy. It becomes easy where the parent is available. Especially in diagnostic interview, it becomes very difficult if the problem of the patient is crucial. Sometimes it takes long hours, sometimes it takes few minutes to complete the interview. Now, we are going to talk about structured interview. This is the last type of interviews. When you talk about structure, the title itself talks about certain systematic ways of questioning or interviewing the client or the patient. Under structured interview, the questions are very specific and clear questions are mentioned. The goal of structured interview is to make necessary observations and also take necessary information related to the patient's problem. The questions in structured interview are usually developed in a tree format as a flow chart. We are going to talk about the various phases of interview. When we talk about interview, what are the various stages of interview? We can't say that an interview begins and ends. So, there is a process. So, what actually takes place in an interview? The first is the opening phase. The title itself indicates opening phase. That means there is a establishment of rapport in the initial stage to know the person, also to introduce as a clinician to the patient. It becomes very necessary that rapport establishment is initially established. In the opening phase, after making the patient comfortable in that particular session, it becomes very easy for the clinician to establish and continue the relationship and get the information required for the further dealing of the patient. The session may begin with a question by asking, what made you to come here? With this type of question, the client may feel comfortable and also respond accordingly, and also talks about his difficulties slowly. Here the clinician's role is to guide the patient with strategic questions in order to encourage a free flowing presentation. The overall aim or emphasis in the opening phase is to allow the client to speak about his present difficulties and problems and their reasons for coming for the session. In the middle phase, this is the major part to play, under which there is a lot of information that is gathered in this particular phase. This is also called as the body of the interview. Here so many problems are discussed, problems in terms of the patient's life events, present circumstances, difficulties, financial problems are discussed, also physical health problems are also discussed. After knowing all these problems of the patient, a tentative hypothesis can be established by the clinician. Not only in terms of getting the information or establishing a hypothesis can also be accepted or refuted, not only considering with the primary information, but also the additional information, that is the assessments, that gives us much more concrete hypothetical information about the patient. By the end of this particular interview, the clinician will have an idea in his mind whether to go ahead with a particular treatment plan or not. In the final phase, before the interview is going to end, there are certain important necessary precautions to be taken by the clinician as well as the patient. Let us see how. There is a need to restore the patient's calm, give him information and plan with him for the next step of the session, which may include assessments or which may include the therapeutic session, which is actually the psychotherapy that can be established. While the clinician is sympathetic, attentive to the realistic needs and feelings of the client, blanket approval or unconditional support is crucial in this particular phase. Sometimes being unconditionally supportive may harm the patient. We are going to talk about various common errors attempted by these new and young interviewers who are in the learning phase of clinical assessments and interviews. The first one is talking too much. There is nothing wrong in talking too much, but it is very important, especially in the clinical setting. The talk should be limited. You should allow the client to talk rather than you are talking too much. How do you understand talking too much by the clinician? In terms of asking too many questions. A good interviewer always tries to listen to the client and also ask little and less questions. Trying to help. In the first session, the role of the clinician is to listen, allow the client talk about his feelings and problems. It is not advisable for the interviewer to give or help him in terms of advices. Now, be specific in what you ask. What does this mean? Instead of saying, tell me a little about, be clear and say, could you tell me something? What made you to talk about your difficulties? Or could you tell me about your relationship with your father? Could you tell me about your relationship with your boss? And many other questions related to, so that you can infer more information from the client. The fourth error is asking several questions at a time. It should not be like that. It should be one question one time, so that the patient is not confused. The last one is asking multiple choice questions. It is very important that the interviewer should ask one question with a probable answer that can be given by the client. Say for example, can you talk about your school? Do you like your school? It should not be in terms of multiple choices where the client may be confused. Now, we are going to talk about the reliability and validity of interviews. How reliable is an interview? How will I know that this particular interview is reliable interview, or whether this interview is a valid interview? Now, when we talk about reliability, it is basically evaluated by two people. Say for example, one psychologist has evaluated a client or a patient about his problems, about his present conditions in terms of his depression or anxiety. The same results should also be yielded by some other assessor or the clinician, say for example a psychiatric nurse. So, taking consideration of these two particular clinicians, there is a consensus of a response that being elicited from the patient, that is, this particular person is suffering from depression by various observable behaviors as well as various interviewing techniques that are being conducted. This is often referred as inter-rater reliability. Especially when you talk about reliability, the standard interviews are more reliable than the unstructured interviews. Another type of reliability is the test-retest interviews. The consistency of scores or diagnosis across time. We expect the test-retest reliability of an interview is quite high when the intervening time period between the initial testing and the retest is short. However, when the interviewing time period is long, test-retest reliability is ineffective. The validity of an interview is necessary and it measures what it is supposed to be measuring or what it intends to measure. The validity of any type of psychological assessment can take many forms, such as content validity, criterion validity, construct validity. In case of structured diagnostic measures, the content validity is widely acceptable. When you are talking about the advantages and disadvantages, it has both its strength as well as weaknesses. Let us see how. When you are talking about flexibility as one of the advantage, when the patient is very comfortable talking about his problems, all his personal problems are being elicited, all his emotional problems are being expressed, all his feelings are being expressed to the clinician. In this way, the client feels that all his problems are being known to the clinician. It becomes very difficult for the clinician to take certain information confidentially, whereas certain information that needs to be addressed to the concerned. Say for example, father, if the patient wants to commit suicide, he cannot disclose or he cannot make that information as a confidential information. He has to report to the parent or the concerned individual that this particular client has a feelings of suicidal ideation. In this particular situation, there is a situation of unreliability as well as biasness. This is one of the disadvantage again. Therefore, the interview contributes only a partial information about the particular problem of the client. It does not support much information about the patient. Henceforth, they have to go for a clinical diagnosis or assessments along with the clinical interview. Now, let us conclude about this particular clinical interview method. Now, this method is one of the basic tool for the clinicians in the assessment process. The clinical interview is a specialized communication. There are various kinds of interviews, say for example, intake or admission interview, case history interview, mental status examination and many other, say for example, diagnostic structured interviews, where if a particular patient has a problem or the clinician wants to suggest a particular appropriate interview, a particular type of interview can be addressed. Now, there are three phases of interview. Say for example, the first phase is the opening phase. It talks about rapport establishment. The middle phase, that means the body of the interview where all the actual information is being elicited from the client, and the final is the final phase, which talks about how to close the session and how to prepare the client for the next visit. Apart from all these, there are also certain mistakes committed by the interviewers, say for example, talking too much and giving multiple choice options for the client, where the client may get confused to respond to a particular question. Apart from this, as I have told you, there are many advantages as well as disadvantages of this particular clinical interview, where flexibility is also available. At the same time, being very flexible also indicates a negative aspect of the clinical setup, where there is a possibility of unreliability as well as biasness. Hence, it has its own strengths as well as weaknesses.